My name is Melissa Jacobs. This is Mainline Tonight. I'm here at City Line Chiropractic to find out about a new laser therapy that can treat neuropathy. This is Dr. John Seward.
Let's get to work.
What does treatment entail with this laser?
That's a really good question. The treatment is very different for each individual diagnosis and each individual patient. So that's the beauty of this laser, is that those treatment protocols are already in the computer. I really don't have to figure it out. So we put all of the demographics in, we put the size of the person, we put skin color in, we put how bad your pain is, and then the computer does most of the work, and you rub it along the skin very lightly.
Now we want to say that is not on because we're going to put our safety goggles on in a second
so
and use it.
But it's just a demonstration, and we use it along the skin, and it is very warm and it feels great and it does not hurt.
Now, how many treatments do people need?
That's another great question. I have people that have come in that we treat them one or two times and they feel great and they don't need it again, but that's also rare. As I also have patients that have chronic pain, and that pain is never going to go away, and this is a really great way for them to help really manage their pain without taking opioids and without being on drugs and having to put something in their system that they can get another side effect. There's very, very little side effects to this laser. One is that you can get the skin a little bit too hot, and so it can irritate the skin sometimes. And then the other part is we can irritate the eyes, and every time that this laser is on, we have protective goggles to make sure that that light does not damage your eyes.
Okay, so we're going to give you a demonstration of what this laser does. I'm going to put on my safety goggles here. It's a good look. Okay, so hit me, Doc.
So we put in the demographic of her size and of an elbow, and we just put this laser here, and we'll just rub it right up and down the tissue, and over a period of time the tissue will get a little bit warm, and the goal here is to get a lot of inflammation out of the area. It is allowed to increase the range of motion of our tissue, but really what it does is it excites the tissue to start healing.
So I don't feel anything.
Yeah, you shouldn't. It should take a few minutes, and then it's going to start to get warm.
But it doesn't hurt. There's no tingling. It's not hot.
Nope. Should just feel great.
It feels great. It feels actually kind of soothing. Oh, it's getting a little bit warm, and it feels amazing.
Great.
Okay, good.
To get people to heal quicker. And then as the years went on, the technology got better and better, and the lasers got more powerful, and they were able to treat more symptoms and more diagnoses. And so I would say September, October, I had somebody come in and tell me that there's been a significant change in the technology again.
Wow.
And I ended up buying it, and the promise that it could do things that I actually didn't think that could happen, and it's pretty amazing.
But you also got a ton of training on this, right? So tell me about.
I've been using cold lasers, or it's not really cold anymore, but I've been using lasers in my office for the last 20 years.
Yeah.
So I have a lot of practice. I've treated many different things with it. I've just never seen anything treat that patients this well.
Okay, so you believe in this laser so much that you're going to give a free consultation to anybody who wants to come down here.
Yeah, if they're interested and they are looking for a way to help manage their discomfort or to get rid of this neuropathy, we get patients that can't walk, and we get them walking fairly quickly, without drugs, without surgery, without injections. So yeah, if they're interested, I would love to sit down and talk to them to find out if this is a great, a great new therapy for them.